So what are you seeing out at your clinic? A lot of flu?
We certainly have seen a great deal of patients coming in with the flu. We have some patients still coming in with COVID as well. And then we have people with just generalized upper respiratory tract infections. We normally test, and if they have the flu, then that gives us the opportunity to provide the appropriate prescription, which is your Tamiflu. If they have COVID, then we can provide the Paxlovid prescription. And it's so important. And we have so many patients that say, I don't want to be tested. I don't want you to stick that thing in my nose. And I tell them that it's so important to allow us to test them, because that way we can determine specifically what they have, if they have COVID or the flu, and give them that specific treatment that's so important, and it could be so helpful. And for some people that are elderly and immunocompromised, it could actually be the difference between life and death.
Dr. Quinn, it's carnival season. Mardi Gras is tomorrow. We just had a bunch of Super Bowl parties. Yeah. Is the expectation that the numbers will get worse?
Yes, because you have to think about it. It's not favorable outdoors, so people are congregating indoors with very low ventilation. And you have people there talking with one another, exchanging those respiratory droplets, a very high opportunity to pass one infection from one person to another. The deal is, what I really want everybody to understand is, if you have symptoms such as cough, runny nose, sore throat, fatigue, go ahead and get evaluated by a medical provider, because if you have the flu or COVID, if it's diagnosed early, then you can get on the medication and you can pretty much beat it. But if you don't get tested and you let it continue, it can get worse and you can develop pneumonia. And then if you're somebody that's elderly or immunocompromised, it can be deadly. So it's something that you don't want to ignore.
Talk about elderly and immunocompromised. Who is most at risk of getting the flu? And is there a group of people that is more dangerous if they get it?
Well, here's the deal. We're all at risk of contracting or catching the flu or COVID. But what we have to look at is our individual personal risk factors. If we're someone that's over 65, our immune system is not going to be as strong as it was when we were 20 years old. So it's harder for us to fight it off. Also, if we have chronic medical conditions such as COPD, diabetes, kidney disease, heart disease, our immune system can be slightly compromised as well. And then we have to think about this. If we're somebody that's not elderly or immunocompromised, we might come into contact with someone like grandmama or maybe a coworker that's elderly. So if we have the flu or COVID, we want to go ahead and get tested and don't go to work. Stay at home and don't go visit grandma, because you don't want to be a carrier and make them sick. But I just want to also emphasize, it's so important we get vaccinated. Get that flu shot, and you can get the COVID shot on the same day. You all did a survey, and I'm looking at a text. You had 84% of people stating that they did not get the flu shot this year. 16% said they got it, and no one said they plan to get it. Right now, a lot of people aren't getting those vaccinations, and it's so important that we get that flu shot and or that COVID shot so we can get that protection that we need.
Dr. Quinn, is the amount that we're seeing of flu cases typical for this time of year, or would you say this is rather unusual?
It's a little bit unusual. It's up. And a lot of the reason behind that is, for the last few years, we've been wearing those masks. We've been social distancing. We've been washing our hands because we were so scared. We don't want to get COVID, but it was protecting us from the flu as well and other upper respiratory tract infections. But now we're just out and about. We're like, hey, how you doing? And we're talking to each other, spreading those respiratory droplets, and we're not getting the vaccination. We're not getting our flu shots. And now we're more vulnerable because our immune systems, they haven't been working out, dealing with stuff for the last few years if we didn't get the flu, and we're more vulnerable, and there's a higher contraction rate right now. So we have to keep all that in mind.
Real quick, is it too late to get the flu shot?
Not at all, not at all. You can go get the flu shot today. You can go to your Walgreens, your family doctor, your pediatrician, Walmart, and you can get it, and you can get the COVID shot on the same day to get that protection that you so much need.
There you go. You heard it from the man. Thank you, Dr. Quinn. Always appreciate it when you drop by and visit with us.